Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Thank you for joining us for Fronteras, A Changing America. I'm Casey Counts. New Mexico is expected to see significant impacts from federal cuts to social programs like Medicaid and SNAP. Our state has the highest percentage of people in the country on Medicaid, about 40% of the population. About 25% of the population, according to some sources, relies on the Supplemental Nutrition Assistance Program, or SNAP. New Mexico Healthcare Authority Cabinet Secretary Kari Armijo joins us to talk about what that means to you, individual families, and communities across the state as policymakers and advisors grapple with ways to fill the gaps. Secretary Armijo, thank you so much for being with us.
Thank you so much for having me, and thank you for all the great work you're doing to help us get the word out about these really impactful changes to New Mexicans.
Well, let's begin with Medicaid, and about 40% of the population relies on the program, according to the numbers we've seen, anywhere between 750,000 to a little more than 800,000 New Mexicans are on Medicaid. Can you reflect that the accuracy of those numbers?
That's right. As of today, we cover 810,000 New Mexicans. That's about 40% of the state's population.
Tell me why so many New Mexicans rely on Medicaid, as far as you know.
Well, in New Mexico, we have a combination of factors. So we've made a lot of deliberate policy choices here in New Mexico, including expanding Medicaid to low-income adults under the Affordable Care Act. We cover children age 0 to 6 continuously from the time that they're born. So low-income children all the way up to their 6th birthday covered without having to renew Medicaid. So we've made a lot of deliberate policy choices. Plus, we also have a pretty rural, high-poverty states. Those two factors also contribute to a pretty dependent system on the Medicaid population for here in New Mexico.
And does that also include tribal communities?
Of course, yeah. I mean, we definitely cover populations from our tribes, nation, and pueblos. They are also really important partners in the Medicaid delivery system.
Well, let me start by asking you about H.R. 1. Now, once the bill is working its way through Congress, tell me about what happens in states across the country and who is rifling through that bill to see how our state is going to be impacted. And at what point did you kind of get a picture of how New Mexico would be impacted by H.R. 1?
Well, as you probably know, the bill changed. There were a lot of different iterations as that moved between the House and the Senate in Congress. But we were watching it closely from the very beginning. So every single iteration of that bill, we were doing analysis to determine how that would impact New Mexico. There were some things that came out of the bill that were, in terms of the federal funding changes that will affect New Mexico that were better for New Mexico, and some things that weren't. And so it's kind of a mixed bag. Overall, we really feel like there's a very negative impact on New Mexico's healthcare system and on our food system here in New Mexico as a result of that federal bill.
Well, before we move into all of those impacts, what would you say is an example of something that actually worked out better for New Mexico?
Well, there are some changes to the way that the SNAP program, the Supplemental Nutrition Assistance Program, will be financed. So even though we're not happy with those changes because they do require New Mexico to share a portion of the cost of SNAP benefits, which are about $1.2 billion here in New Mexico, there is a new cost sharing requirement for states. New Mexico is in a delayed, we're one of the states that's going to be delayed. So we'll be impacted by that, but we have a couple of years to implement that versus some other states are really being affected by that immediately. So even though we're not happy about that overall change, we do sort of have a positive impact from the delayed implementation for New Mexico.
Well, let's get back to Medicaid itself and when we expect the changes to come. And maybe you can start by just telling us, what are those changes going to be?
So for Medicaid specifically, there are going to be a number of changes that really start next at the end of 2026. So the biggest changes are really going to be around new, what they call community work requirements. So individuals who are enrolled as adults on the program are going to have to show that they are working, that they're involved in a vocational program, or that they're volunteering, or education. And so that will be a new requirement. Folks will have to verify that they are doing that to maintain their eligibility. And then there's also going to be a biannual verifications process. So right now we verify income every 12 months. We'll be moving that up to every 6 months under the new bill. So folks will have to re-verify their income more often. And then also next October, in October of 2026, there's going to be some big changes in terms of the lawfully present immigrants that can be covered on Medicaid, with many people who are here lawfully losing eligibility for Medicaid and having to go find other coverage.
Why would people here lawfully lose access to those benefits?
Well, it's just a change in the federal bill. So they've kind of removed certain statuses. So folks who are eligible to receive Medicaid, such as refugees, asylees, individuals who are here lawfully but able to stay without fear of persecution, those are some statuses that will be changing. So next October, those individuals will no longer be eligible for Medicaid.
Do you have an idea about what the numbers of those individuals are in New Mexico?
Yeah, that population is about 10,000 New Mexicans that are covered today on Medicaid that will be losing eligibility.
And let's talk about how many people are working but also receiving Medicaid.
Yeah, the vast majority of individuals on Medicaid are working. If they're not working, it's usually because they have a disability, they're elderly, or some other situation that really they can't work. But by and large, we know that about 80% of Medicaid recipients, if they're not children, so adults, are working if they're eligible to work. So by and large, they're working already. It's just a matter of that additional paperwork, that additional administrative headache that folks will have to follow through to make sure that they're proving that they're working. Today, we just check their income, and then if they're eligible, we allow them to stay on the program. And in the future, that's going to change.
Do we know how many people we expect to lose coverage in New Mexico? I've heard lots of different forecasts and estimates for different places. Do we have an idea here in New Mexico?
Yeah, we're estimating, and again, these are estimates, so it's early days yet, but we estimate that about 90,000 New Mexicans will probably lose coverage as a result of the new work requirement. That work requirement will affect 254,000 people, so about 90,000 of those folks will likely to either fall off of coverage or to fall off and then come back later.
And so for people who are working and receiving Medicaid, talk about what the paperwork provides in terms of a challenge, and maybe you can tell us a little bit about why we refer to those things as administrative barriers.
Well, the state will do everything we can to try and make sure that we understand if someone's eligible without sending them additional paperwork. So we check our data sources, we try to check income, whatever databases are out there. We try to do that proactively so that folks don't receive paperwork unless there's something that we can't do to verify that. But at the end of the day, if someone's getting a notice from us telling them that it means that they have to verify something and then send it back or bring it to our office. And so that's the piece that's additional headache for folks. We know that it's just really hard. If you've ever been a person who has unopened mail in your home, you know that you've got to really pay close attention to that. And so it's just additional workload for folks who really are still eligible, they still qualify, but they have to prove that they still qualify.
I feel like you're watching me at home. Yes, big pile. Let's talk about those folks who aren't able to work, say due to a disability. What will be required of those individuals? Do you know at this point?
Well, we haven't received federal guidance yet, but we do know that individuals with disabilities, including individuals with certain behavioral health conditions, will be exempt from the work requirements. We just don't know exactly what that implementation looks like yet because we haven't received that federal guidance.
So let's talk about what you might see, what maybe you're hoping to see from legislators as they go into, as we are having this conversation, it's before the special session, but I imagine while we're watching this episode, they are in special session. So talk a little bit about what you do to prepare for that.
So right now what we're doing is thinking through what the operational impacts are for our agency, the Healthcare Authority. So how many more staff do we need? How many IT changes do we need? How much additional mail are we going to be sending out? So we have to factor all of that into our budget. And we have to really get ready. These are very big changes. They require a lot of IT changes. We need to staff up accordingly because it's more tasks for our agency and for our frontline workforce. So those operational impacts are part one of what's really factored in for the special session. I think we're also really looking at what can the state do to minimize the impact of these changes for New Mexicans. So what can we do to keep people covered? How can we make coverage more affordable? If they're not eligible for Medicaid, can we help them afford coverage through the marketplace, Be Well New Mexico? So those are the kinds of changes that we're thinking about on the healthcare side, really making sure that there's enough policy there to support our rural healthcare providers. All of those things are kind of under consideration, as well as similar thinking around food benefits.
I just read a forecast the other day that suggested that New Mexicans can expect to pay maybe over 50% more for their health care coverage under current conditions. Can you talk a little bit about why this impacts that health care availability and its cost?
Yeah, absolutely. I mean, I think every New Mexican, whether you're enrolled in Medicaid or not, is somewhat dependent on the Medicaid program because it is a big financing operation. We keep providers whole, especially in our rural provider networks. And so when there's big changes to Medicaid, it affects the entire landscape here in New Mexico. If there are provider closures, if there are hospitals that close, they serve everybody in the community, not just Medicaid. So that's just becomes a pinched access point for all New Mexicans. And then the other thing that happens is when people roll off of Medicaid, a lot of times it's the healthiest people who sort of forego all of that administrative burden and the sickest people who stay covered. And that means more cost as well. So the folks who really need something, or they wait to come back to coverage until, they really need something. They're in the hospital, they've had an accident, whatever it is. And so we end up paying higher cost claims to our providers just to make sure that everyone's got what they need. And so that also impacts everyone across the entire market, whether you're receiving coverage through an employer or through Medicaid.
Do you expect impacts to Medicare recipients as well?
Well, I'm not as expert on Medicare. Medicare is run by the federal government, and so I can't predict what will happen with Medicare. That is entirely sort of done not through any state partnership at all. What I could predict is that maybe Medicare rates are being looked at, what we pay our providers through Medicare, which also affects Medicaid because we set our Medicaid rates based on what Medicare does. So there's impacts across the board ready to happen here in New Mexico.
You mentioned and explained that really well about how all the programs are under pressure as a result. And you mentioned healthcare providers. So let's talk about that ripple effect and why we hear so much about the possibility of rural hospitals closing.
Yeah, here in New Mexico, we've done a lot of work to try and make sure that our rural hospitals, all of our hospitals really, but our rural hospitals are taken care of financially so that they can stay open. We really see those as important access points, but it's harder in a rural community where you don't have as many patients and you have higher fixed costs that you're trying to compensate for. In New Mexico, we have a program called the Healthcare Delivery and Access Program. That program will phase down under the new federal bill. The reconciliation bill phases out our payments to hospitals. Right now, we're paying hospitals at higher rates, reimbursement rates. That is going to phase out. About $8.5 billion will phase out over the next 10 years. So that reimbursement will be lost to New Mexico's hospitals. And that's really why we're concerned about those closures.
Do you have a sense for how many hospitals across the state would be at risk?
Yeah, I mean, right now we think about 6 to 8 hospitals could close over the next 24 months or so. It's still pretty early. We're watching the situation. We're trying to work with our hospitals as much as we can to make sure that we provide that financial support and other ideas around how we can help them stay afloat. But yeah, probably about 6 to 8 hospitals that we're concerned about.
All right. Well, let's move on to food insecurity in our state. I read some sources say 25% of the population is reliant on SNAP. Does that reflect the numbers that you see?
Yeah, we cover about 459,000 New Mexicans through the SNAP program. So yeah, that's about 23% of New Mexico.
And what do you anticipate in terms of SNAP cuts, and who will be impacted the most?
Well, SNAP changes are coming a little faster, actually, than the Medicaid changes, so it's really important to know about that. We do have some changes happening really in November already. So what's happening in November is that certain income deductions that people are allowed to take will be going away. So that affects about 32,000 New Mexicans. So they'll either lose eligibility for SNAP or they won't get as much benefits because the way that we calculate their income is changing. So that's happening in November. We're also losing the SNAP Ed program that provides education and outreach. It provides some staffing even at New Mexico State University. So that those funds are kind of getting ready to expire. And then there are major impacts also to the lawfully present immigrants here in New Mexico. Those statuses are also changing, and that will be going into effect later this year. So about 16,000 New Mexicans likely to lose SNAP eligibility due to those changes in the immigration status.
Before we move on from the topic of food insecurity, we'd like to take you to Silver City, where our former KRWG senior TV producer, David Vasquez III, visited the Commons, a food security initiative to provide healthy, fresh, locally grown food to the community. The Commons allows those in need to pick out, grow, and even distribute food. And it provides educational programs to help sow the seeds of sustainability, growth, and local self-reliance.
In 2008, when the mines laid off, we began to really look at what the community needed in terms of services. It was clear that there weren't enough services for the people that were really impacted by what was happening with the economy. And we went around to all of the communities in Grant County and held town halls about what kind of services were most needed in the community. And the top interests were a food pantry, a senior and children's nutrition, and community gardens. And so we began to put that together in a package. The first thing that we did was create a food pantry. We knew that what we wanted was a project that demonstrated sustainability to the community. So the building design is specifically about that. So we engaged an amazing architect to do that. But the bigger vision was really to create sustainability around teaching people to garden, around economic sustainability, a commercial kitchen that was modeled on the Mixing Bowl kitchen in Albuquerque.
Currently, we're serving over 1,200 families, and that can include one person or up to a family of 4, and then some of those are multi-generational families if they're receiving food boxes. So we do that through 5 different programmatic areas. We have our food distributions, we have our commercial kitchen programs, we have serving the Alimento para los Niños backpack program in the schools, we do our gardens, volunteers, and our youth programs.
I am currently the Healthy Kids, Healthy Communities Coordinator for Grant County, and we work really closely with the Commons to bring that kind of education to all the elementary schools in the county. And that's really the whole idea behind the sustainability piece, is to really teach people, and not just teach them, but give them an opportunity to have a voice for their own advocacy.
So we have a lot of fruit-bearing trees. We have peaches, nectarines, apples, and then in our garden space we have different types of peppers, bell peppers, hot peppers, jalapenos, tomatoes, eggplant, different leafy greens, lettuce, chard, things like that. Our goal moving forward is really to help increase and bolster those programs so that we are kind of training the next generation to be able to be excited about food, to be excited about vegetables. And I think when you give kids the opportunity to play with soil and play with, seeds, and understand that, okay, I can grow this from the beginning and then I can take this into the kitchen and then I can make something delicious, they get really excited about that. And so, we're only hoping to expand those areas more.
You can find just about anything you want to about the Commons in social media, website, Instagram, Facebook. Call us at 575-388-2988. Food is the number one thing that brings people together. You can share your culture, share your history, share your dreams, share your visions around food. And there are many different ways that the Commons facilitates that happening in this community.
We're talking with New Mexico Healthcare Authority Secretary Kari Armijo. And before we move on to other topics, I'd like for you, Secretary Armijo, to address what you see across the state in terms of how individuals and organizations like the Commons are responding to the needs they see in their communities.
Well, first of all, I'd like to express my gratitude and appreciation to every community in New Mexico for making sure that the people in their communities are fed. This is a really important issue, and the SNAP program alone doesn't keep families from feeling hunger or experiencing food insecurity. So I'm really grateful for all of our local partners. I think that pressure is going to increase. Our local food banks are probably going to experience more pressure, longer lines, more demand. Our schools are going to experience more pressure as well to keep our families fed, our kiddos healthy. So all of those local partners, that's really where that pressure is going to be experienced. And so anything that we can do to support food programs like that, we're really looking at ways to augment that for New Mexicans so that we can continue to support New Mexicans where they need us.
We did start hearing alarm bells from local food banks months ago. I think even before we had HR 1. So would you say that New Mexico is a place that suffers from food deserts? What does that mean, and what would your office be doing to try to address those?
Yeah, I mean, New Mexico absolutely has food deserts. We have lots of places where food banks sort of bear an inordinate burden. And we have food even in the parking lot here at the Healthcare Authority here in Santa Fe. We see once a month folks lining up to get food resources. So we know that that is real concern all over New Mexico, but especially in certain rural areas. I would be remiss if I didn't mention that these SNAP reductions also affect our grocery stores, our retailers, our convenience stores, our gas stations, those folks that sell food. It's going to put additional pressure on them, either through price increases to other customers or potentially having to shut down operations. So we know that these are pretty big changes, and our local retailers are dependent on SNAP revenue to stay in business. So that's a real issue, and we know that we are going to have to do more to support our food bank operations, for example. So that's definitely something that we're looking at with our budget.
Well, explain what kind of conversations you're having with those types of folks who are impacted, how we referred to it earlier, maybe the ripple effects that people may not necessarily see on the surface, and how even if you're not necessarily using that program yourself, how you could see those impacts.
Yeah, I mean, we work really closely with our food bank partners to try and figure out what's going on. I think oftentimes they're the pulse of our communities. They can kind of tell us what's really happening. So lots of engagement and conversation. We're also here in New Mexico covering food as medicine. So we're covering food as a Medicaid benefit. So providing home delivered meals through our food banks to high risk pregnant women and seniors who are at risk of institutional care because of food insecurity. So we're really leveraging our food banks even as Medicaid providers in the healthcare ecosystem here in New Mexico.
You mentioned delivering meals to high risk pregnant women, seniors. Is there any specific group in the population that you think will be impacted most? Is there a particular group that you're most worried about?
Well, that's a really hard question for me to answer because I worry about all people who are at risk. You know, you've got a lot of people with disabilities who may be homebound. You've got seniors who may be in the same situation. We're looking to provide additional supplementary food support to those populations. We expanded our supplemental food benefits from $25 to $100 in the past year. So last October, we started that benefit with legislative support. That benefit is going to start to grow because there's going to be increased pressure, but we're really concerned about those populations. And then, of course, New Mexico is #1 with food insecurity for children. And so we're really paying close attention to our kids across New Mexico and what we can do to provide support through summer food program and free meals at school.
With the little bit of time we have left, I'd just like to have you offer some thoughts in terms of maybe what you want people to know that we may not have touched on, or where they can go for resources if they're concerned about these services.
Thank you. I think the main thing I want folks to know is this doesn't just affect you if you're on Medicaid or SNAP. This affects every New Mexican. We live in a very small state where all of these programs are really interconnected. And so all of us should be really worried about what happens to access to healthcare, what happens to access to food benefits. Do these things become even more expensive as we kind of look toward the future? And so I think those are the things that everyone should really be paying attention to. These are not just changes that affect you if you're specifically on Medicaid or specifically on SNAP. So hopefully everyone's going to be paying close attention. More information is available on our website at the Healthcare Authority. And then to apply for benefits, any New Mexican go to apply for benefits at yes.nm.gov, which is a free online system for looking up whether you qualify, and we can determine oftentimes in real time if you qualify for Medicaid, so you can get a determination within seconds. So hopefully that helps folks know where to go for help.
New Mexico Healthcare Authority Secretary Kari Armijo, thank you so much for taking the time to be with us.
Thank you so much for having me.
And thank you for joining us for Fronteras, A Changing America. You can find this episode and any you may have missed on our YouTube channel, which you can access at krwg.org, where you can also sign up for our weekly Friday news wrap or become a member anytime to support local programming just like this. Thank you.